Okay, is it new? Should we start? Oh, yeah, is it? Mhm. Yeah, okay. Hello, everybody. Thank you for coming. I'm Jennifer Isherwood. I work with the Native American students here at UMaine Machias and throughout the state. Welcome to our talk today, and thank you for coming. From Machias, we are launching an event series called Wabanaki Voices. The series invites members and allies of Wabanaki communities to share their work, their art, their concerns, and their vision. We hope to have at least one event per month, and we welcome suggestions on participants. To help develop the series and plan related activities, I've been working with a special group of Native American students here at UMM. These 4 students applied for and were chosen to be Ginat mentors. In Passamaquoddy, Ginat means protector. Ginat mentors are expected to be protectors of the Wabanaki Confederacy, strengthening their community through events, supportive peers, and connections with younger students. Throughout the semester, mentors help to plan and participate in both on and on-campus activities, such as this one, that build Native relationships and culture at UMaine Machias and throughout Washington County. I'd like to acknowledge our present Ginat mentors by name: Sydney Neptune, Ace Tompkins, Ace is here, Xander Lacombe, Xander's also here, and Emma Socktomer. Thank all of you for your enthusiasm and work. Now I'd like to turn it over to Dr. Tora Johnson, UMM Science Division Chair, to read the land acknowledgement.
The University of Maine at Machias recognizes that it is located in the homeland of the Passamaquoddy tribe, where issues of water and territorial rights and encroachment upon sacred sites are ongoing. Passamaquoddy homeland is connected to the other Wabanaki tribal nations, the Penobscot, Maliseet, and Micmac, through kinship, alliances, and diplomacy. The university also recognizes that the Passamaquoddy tribe and the other Wabanaki tribal nations are distinct, sovereign, legal, and political entities with their own powers of self-governance and self-determination. Thank you, Waliwan.
Do we need to share?
She should, hopefully we can hear her.
Can you hear me?
Yes.
Oh, good. Okay. Hello and welcome, everyone. We're so excited to hear about the changes in Wabanaki Public Health and Wellness, which has received so much positive attention under Lisa Sockabasin's leadership. Earlier this month, Wabanaki Public Health and Wellness was selected as a recipient of honor at the 2021 Giraffe Awards. The award was granted by the Maine Children's Alliance and honors community heroes who stick their necks out for Maine children, youth, and families. Congratulations. I'm delighted to introduce Lisa Sockabasin, co-CEO and an architect of the expansion, which according to Maine Biz, it is unusual to find a nonprofit growing at the speed of a startup, going from 7 employees to about 100 employees. Lisa is a citizen of the Passamaquoddy tribe at Madocmigook with extensive experience and expertise in tribal, state, and federal governments, nonprofits, and philanthropic organizations. Lisa has over 19 years of experience addressing inequities experienced by and providing opportunities to tribal populations. Under Lisa's leadership, Wabanaki Public Health and Wellness continues to develop and implement culturally based programs to respond to community needs. Prior to joining Wabanaki Public Health and Wellness, Lisa served as the director of the Office of Health Equity in the Maine Department of Health and Human Services. She served as an epidemiologist in the infectious disease program for the state of Maine and as a nurse epidemiologist with the Northern American Indian Center of Boston, Incorporated. She also serves as coordinator to the 4 Directions Summer Research Program with Harvard Medical School and the Brigham and Women's Hospital in Boston, a capacity she still serves in. Lisa holds a Bachelor's of Science in Biology and a Bachelor's of Science in Nursing, both from the University of Maine, as well as a Master's of Science in Health Policy and Management from the University of Southern Maine. She holds a graduate certificate in nonprofit management and organizational strategies. In 2005, Lisa received the Schott Fellowship in Early Care and Education at Cambridge College, Massachusetts, and has participated in the Institute for Civic Leadership in 2007, and in the 2006, and in 2007, the Leadership of Maine class experiences, allowing her to hone her policy research, leadership, and advocacy skills. Lisa also serves on a number of boards, including Maine Philanthropy Center, Planned Parenthood of New England, and the American Civil Liberties Union of Maine. So please join me in welcoming Lisa Sockabasin.
Thank you, Lois Ann. Just want to do a check with you, Lois Ann. Can you hear me okay?
Yes, I can. I can hear you fine.
Great, thank you. And just one slight correction, I do not serve as the Four Directions coordinator at the Harvard Medical School and the Brigham and Women's Hospital anymore. I actually stopped doing that right during the pandemic. So just wanted to make that slight correction. Thank you so much for this warm welcome. It's always real humbling to hear somebody describe both the organization and the work that you've been so committed to, because we all know in this room that that work does not reside in one person, right? It's a community. And now we have an organization, and I'm going to share with you some of the work and growth that we've experienced over the past couple years. It's been fast. And also engage you in a conversation about where are those opportunities for us to connect? Where are those opportunities for you to be engaged in this work and for us to be more engaged in the work that you're interested in? So I'm going to share the screen and we'll get started. Interesting, it's just there. This is our beautiful logo that really signifies growth. It was created by Francis Socktoma, who is a Passamaquoddy citizen right here in Washington County. So we mentioned the tribes. Thank you for that land acknowledgement. I also want to welcome you to Passamaquoddy territory, right? Territory that we've been connected to for over 10,000 years. And these are the communities we work with. These are the nations we work with. And we consider them nations, sovereign entities, and thank you for that acknowledgement as well. So Passamaquoddy at Indian Township, Passamaquoddy at Zibai, they're not so far from here. Then we have Penobscot, closer to Bangor, Holton Band of Maliseet, and the Aroostook Band of Mi'kmaq, which are in Aroostook County. So these are the communities we work really closely with. We work hand in hand with tribal leadership, really wanting to prioritize the work that we're doing with their priorities that they see each and every day in the communities. So we work with the chiefs, vice chiefs, tribal councils, often to talk about what their priorities are. One of the things I'm going to talk a little bit more about in depth is our work in the area of recovery. And one of the projects that we're doing, which we'll see some pictures of, was really because these tribal leaders came together and said, we need support. We need services that are culturally appropriate for our people right here, near us, so they can heal, near home. And when they're ready to go back home, we need those services in the communities as well. So that's part of the story that I'm going to be talking to you about, is really work with all the tribal nations to really prioritize what are those areas of healing that we need to understand. So this is what we say at Wabanaki Public Health and Wellness. Wherever you are on your journey, we have a place for you. Meaning, we don't leave anybody out. And we measure our strength by that. So in order to do this, you can imagine there's a lot of responsibility in this. And you talked a bit about the growth of the organization, and it has been fast. I came in about 3.5 years ago, employee number 7, and we are over 100 employees now, and we're hiring everybody. So I want you to know that as well. But we need a big team if we're going to hold this responsibility to our core. And that's what we're busy doing. And it's no secret, I'll let you take this in. Historical trauma is something that Indigenous people are very familiar with. Not just familiar with, feel the impacts daily. Our statistics, I won't get into all of those, but we know that health disparities have not escaped our communities, and that our life expectancy is far less than the average Mainer as a Maine tribal citizen. So we know about the impacts, which we need to be responsible to, and we need to create healing to address. But we also have to remember this, and those are our generational strengths. And let me move this group of people here over here, and then you guys can read the codes, right? In the room. So generational strength, I'll give you a moment to take that one in. This is where we want to be focused. We know what our responsibilities are, and we want to be focused on this strength. And in each of the programs at Wabanaki Public Health and Wellness, this is where we focus. I'm going to move this for the people in the room over here. How do I just do that? Whoops, sorry. Sorry, guys, everyone's giving me instructions and I still don't know what I'm doing here, running this. How's that? Okay. There, now everyone can see the screens, I hope. So this is the organization. It's big. You know, when I was talking to my team back in Bangor this morning about all the programs and majors at UMM Machias, I'm like, wow, there's so many places where your majors fit into some of this work. And so I want you to be thinking about that. So Wabanaki Public Health, it's a big organization. That's probably our biggest department right now. We have a lot of prevention work going on here, a lot of youth work, a lot of focus on responding in a culturally appropriate way to crisis in the community. This is where the work lies for addressing the water crisis here in Washington County in the Zibayag community. The Passamaquoddy community for my entire lifetime has never had clean drinking water. Think about that. Generations, not clean drinking water right down the road. But we're fixing that. And we're fixing that with collaborating with tribal leadership and really looking to pull in support, financial support, to work with the municipality and address the issue that exists right now, and really thinking about strategies that even if that municipal water system should fail again, we're looking at creative solutions that would not put tribal citizens in jeopardy. So that's our public health work. Wabanaki Health and Wellness. This was the merger. Wabanaki Health and Wellness was an organization for many, well, at least two decades. And a lot of their work was working with some of our most vulnerable Indigenous people here in the state, and many of them in the Bangor area. They focused on some of our chronically unhoused people. They focused on issues of substance use disorder, and had been for a very long time. So their small organization joined with Wabanaki Public Health. And then we also together created Wabanaki Healing and Recovery. So these are now all departments within this larger organization. And we'll talk about Wabanaki Healing and Recovery because that's the newest area of our work. And that's where there's a lot of momentum and a lot of energy, where I'm hoping you see yourself in some of that work. Wabanaki Data Research and Innovation, this is also very new, and I wanted to spend some time there because I think that's an area where there will be some interest as well. So the Center for Wabanaki Healing and Recovery. These are the properties so far, and we're growing, but these are the properties that we are focused on right now, and we are in different stages of renovations on each of these properties. The first, however, I'm going to talk about is the Gathering Place. Here's just some quick snapshots. This is a tobacco plant. I'll talk a little bit about our connection to our sacred medicines, but this is a tobacco plant. This is why we have the Gathering Place. It's about connecting to what heals us. And what heals us is the land. And what Indigenous people have had not enough access to for far too long is land. So this is the work that's happening on this beautiful 47-acre property along the sacred Penobscot River in Millinocket. It connects us to our sacred medicines. We're building a more profound relationships with our sacred medicines than we ever had. And what is so amazing is that with the opportunities that COVID brought to us, and yes, it brought a lot of despair, and it also brought us some lessons. And one of the lessons that we learned is that we were not procuring and growing at Wabanaki Public Health and Wellness our medicines. We were getting them from often outside of the state of Maine and often outside the region. And so what we decided to do, because there was such a scarcity at that time, was we started to grow our own tobacco, and that was the plant that you saw. I'll leave you with this quote. In some native languages, the term for plants translates to those who take care of us. Just think about that, the responsibility in that, right? And a lot of this work is truly about the responsibilities that we all hold, and not just as Indigenous people, as a society, to begin to address that historical trauma that I provided you the definition of earlier. Our medicine walk, so I encourage you to come visit us. This medicine walk was created by people who are in recovery and in our programs, as well as people in our food sovereignty internship program, which is an internship program for Native students who are in high school and really interested in food sovereignty. And that's a joint program with Wabanaki Public Health and Wellness and the Maliseet tribe themselves. And so we'll talk more about other internship programs a little bit later, but they created this. And what I say with this work is that this is substance use prevention. This is cultural connections. This is what it means to heal as a community. Go on to the next slide. These are our youth interns right here that I was talking about. And, you know, we're oftentimes, One may see weeds, we see medicine, we see abundance, we see opportunity to connect to science, to connect to culture, to connect to each other. And they're making these wonderful jellies and teas, and they're being enjoyed at, when we gather safely. And what is so really, really cool at this property, at this healing place, is that it connects us to our Indigenous foods as well. One of the things that we also were concerned about during the start of the pandemic was not having access to fresh fruits, vegetables, our Indigenous foods. And we really didn't have a system of real fast access and transport. So one of the pieces of work that we focused on was having an Indigenous food truck that delivered foods to each of the communities that were traditional foods for the most part. And we're growing the foods on this property. We have a 70-foot greenhouse, hoop house that was built by our interns and people in recovery, as well as others in the community that came together to build this project, which was such an amazing process to watch because you saw healing in the process. And then as things grew, you saw healing in watching that process as well. So I hope you took some time to take in that quote. This is another place I want to introduce you to, and it's our Family and Friends Connection Center. We are in the very beginning stages. The property is the white building that needs a lot of renovations, and we're in the process of raising money and writing grants for those dollars now. But this place is a place where families can come and support their loved one that is in recovery services at our Healing Lodge, which is a place I'll show you in a moment. So what we say is wherever you are in your journey, we have a place for you. So if I am in recovery services and I needed a place for my son and my husband to be there too, there's a place for them. And so we're creating what will look like a beautiful inn, a beautiful place for families to have their own room, their own place. What also will occur here is childcare. So we are creating childcare as well in this property. And so we're excited about potential places of connection with universities like yourselves who have also a commitment to childcare. This is our Healing Lodge, a beautiful property in Millinocket. This is, where a lot of our healing services are offered, are more clinical-based services. I'll show you a list of those in a moment. But what was so wonderful about this property is that before we even purchased the property, the man created this property on his own. These are logs that he cut down. These are stones, and there's a beautiful fireplace, stones that he collected around the riverbanks. He was so connected to the land and using those products that we felt that connection when we walked in. What we also did was we gathered for well over a year Indigenous elders and healthcare providers and knowledge keepers, and really a diversity of people came together every single month. And we started to ask the questions, how do you want to feel when you walk in? What do you want your family members to experience when they walk in? And we created this space based on those pictures. We wanted to also make sure that when we were in those clinical spaces, that what heals us, we bring with us, that we make sure that we're incorporating our medicines and the outdoors in every aspect of this property. These are just some snapshots, but I again invite you to reach out if you are interested in the field of healing, in the field of connection. What I didn't say at the gathering place is that the gathering place is our place of ceremony as well. It's our place also to get outdoors and connect to the land. There's over 40 campsites on that property that we are rehabbing so people can connect to the land. We also have guides that can take you down the river, or you can hike Mount Katahdin. So that connection, we believe, is deeply healing, and wherever you are in terms of your abilities, we make sure that we can connect you to the land regardless of limitations. List of services. Here's just a quick list for you to take a look at, and our brochures down there at the bottom. These services are services that you would see in many recovery and, intensive outpatient programs that are across the country. We visited many when we created this vision. But what you'll also see is that connection to the land, connection to the culture, connection to those values that we believe is what's really healing the people that have been through our programs or are in our programs currently. Real quickly, the Center for Wabanaki Data Research and Innovation, this again is an exciting new effort for us at Wabanaki Public Health and Wellness. This is where the work of developing community health improvement plans for each of the tribal communities will be housed. This is work we've done in the past, but now we're connecting it to this center. We also are conducting needs assessments. We've done that in the past, but now this work is going to be held in the center. Why that's so important is because we have received funding through the National Institutes of Health, which is very exciting, to create a center for research. And I'll go into the details of some of those projects because they're very much connected to our young people and creating more opportunities for our young people to engage in research. And so one of the things that we're looking at as well is what we call decolonizing data, or making sure that the data is reflective of our communities. Oftentimes we are made to be invisible in data sets, and that has not served us well. And when resources are limited and you do not show up in data sets, you do not get the resources. And we have generations of examples of that. And so we're creating systems that reflect our communities so we are not going to be invisible anymore, because those data sets are really where I believe the stories and the ways that we collect that data is going not just to benefit our communities, it's going to benefit all communities when we look at the Indigenous ways of doing this work. Our community-based participatory research work, I mean, this is a big team, and this is the team it takes when you're doing community research in all the communities. When we look at the award from the NIH, it was a part of what's called NIH. So if any of you in academia, if you've heard of NIH, we were the first tribal organization awarded east of the Mississippi for one of these awards, which is really exciting because they've been around for a while. And so what we're creating is that research center for health, where we tell the story, where we hold the data. The projects that we're working on are one, working on looking at the voices of our elders and making sure we're doing everything we can to make sure those voices are heard for a very long time. So we're looking at brain health and the importance of the prevention work related to that. Geared Up is a program for Indigenous people who have interest in research. And so we're looking at lots of projects in that area. Wabanaki Research Review Board, I'm sure many of you have heard of IRBs, institutional review boards. And we have not had one for Wabanaki communities. And so we are in the process of that as well. Our partners are Washington State University and University of Miami. So I'm going to go right past this because I want to go here. That slide just showed you the rapid growth of the organization and where we think we're going. And one of the things that we're also committed to is our collaborations, our partnerships with people like all of you, with this institution, with the WAYS program, Wabanaki Youth in Science. This program is led by Tish Carr, who's here. And what's exciting about this work is that this is a long-term investment. This working with WAYS, they're connected for the long haul. And they have all of these ways of connecting that allow you to then perhaps move into an area of growth that you're ready for at a different stage of your development. And so what's really great too is that their internships are paid. So that's exciting, as are the ones at Wabanaki Public Health and Wellness. We really believe in making sure that youth voice is compensated because we are learning just as much. And so there's lots of opportunities here. When we think about the organization in general, and I'm just going to do a time check. Tori, where are we? Is 12:33. Okay, we're okay. Okay. When we're talking about our future vision, these are young tribal members, tribal citizens, I should say, at the gathering place. Our young people feel connection there. One of the wonderful things is when I think about my connection to sacred tobacco, that sacred tobacco always came in a can. And while it may have had Indigenous pictures on the outside, it was in a can. And now these young people, their connection to tobacco is that beautiful picture that we saw earlier, that's what you do. And you're not done yet. It's actually a process. And it's not just a process, it's a ceremony, right? Those connections are the connections that have been lost, but not really lost, right? We knew where they were. And now we're making those again. So a lot of our future vision always is we want to be here for as long as we need to be here. We believe in the actions that we take today are for 7 generations in the future. Think about that responsibility. And realize during my entire conversation, I talk about responsibilities and I don't talk about rights. We've become a very rights-oriented culture. It's harmed us. And so we want to be here for the next 7 generations. So how do we do that? Well, we have to build those collaborations, those deep partnerships. We also need to be creative in our nonprofit and how we're funded. And thank you, Lois Ann, for reading Maine Biz quote, because yeah, the growth is more like a startup, not a nonprofit. And I would say, keep watching because I hope our funding structure also looks very different. And I think there's a lot to be learned in that space of how we can be thinking different in terms of that funding structure for nonprofits. Maine is very heavily reliant on its nonprofit infrastructure. And that nonprofit infrastructure is very heavily reliant on what? Bingo. That's scary. Should be. So, because what happens is even if a big grant comes in, it does go away, right? So we need to be thinking about the sustainability. So what we're thinking about is how we can have many different funding streams coming into our model, right? So we're looking at enhanced recovery programs. We're opening a detox facility, an Indigenous, culturally based detox facility in Bangor that's going to be open to everyone. Because we believe the way we heal, it's definitely all going to be licensed, and there's ways of doing that clinically, but it's going to be centered on Indigenous values. And we believe that's healing for everyone. Because what are Indigenous values based on? Love. It's that simple. And so we're looking at those expansion of services because we believe that that will matter, not just for us, but for all people. We need more recovery homes. We are desperate for more recovery homes. And it's a hard time to be desperate in this housing market. And we're in the middle of a global pandemic. It's a hard time for people in recovery. It's a hard time for people who want to be in recovery. And we need homes. So we're looking right now at a few homes in the Bangor area to expand that, because when we say we have a place for you, I can't have a waiting list. And right now, today, I do. So that work, we're working on expanding immediately. We're also looking at efforts around sharing our knowledge in ways that actually bring in money. It's valuable the way we heal. And we want to share it. But we also need to get paid because our people need to be served. And so we're looking at a lot of exciting efforts in the area of cultural tourism and bringing people to the land that we're describing to you. I'm going to stop there and open it for questions or comments. I'm going to chew woolly one. Thank you. I'm going to stop share here. There is a microphone in the room if there are questions here.
I just invite people on the Zoom too. Will you be?
I think so. Yeah, please, questions, comments, thoughts, connections.
So, where is the health walk that you referred to?
Yeah, so I'm gonna, yeah.
Can you describe how the approach to build that or make that happen?
Yeah, so the question is, how was the health walk, which is our medicine trail, how was that created? And I think that was pretty much, I can just briefly tell that story. So that walk first, we believe we need to be connected to the land. So our team started walking the land and they started connecting to the medicines that were naturally growing on the land. And they created this walk that brought you to the places where these medicines were abundant. And they started labeling these places. And what was very cool about that process is when they were done, it very much resembled a Wabanaki double curve, which has meaning in our community. And so that's the short story of the medicine walk. And it's located in Millinocket along the sacred Penobscot River. And it's our gathering place. It's well marked, so you can't miss it. And yeah, I invite, it's sort of cold now and there might be some snow on the ground, but it's definitely a place that you should see and connect to. Oh, now you're really challenging me. Oh, I see it.
The division chair for the outdoor recreation.
Oh, wonderful. We should talk, Karen.
Yes, I'm very here. Hopefully you can hear me. Yes, I'm very interested. I have a deep passion for this kind of work, for connecting people with the outdoors, and I just love to get involved, and I have experience with cultural tourism. So I don't know how I can be of help, but if there's ways that I can combine efforts, I would, and at the very least, I'd love to hear more about what you're doing in your medicine walks, and what you have in mind for developing cultural tourism. I've seen that be a very effective tool in other communities in Central America, and I'd love to see more of it out here.
Yeah, we have big vision in this area. We also have big protection in this area, as you probably were prepared to hear. So that, there's a line there in terms of the level of sharing, the level of looking onto a community, that is not something that we will be entering into, as you probably would have guessed. We just had a conversation with the tourism department at the University of Southern Maine and linking their students to some projects that we have in mind. So, I thought about some opportunities here at UMaine Machias too, looking at some of those degree programs and thinking about how they're connecting their outdoor programs to some of the work that both Wabanaki Public Health and Wellness is doing, as well as WAYS. So lots of opportunities for collaboration there, but we should definitely talk about your experience there and ways of potentially collaborating.
Yeah, and if I can, work it into courses and involvement with students, projects. I was thinking about your, putting together and the campsites, for example. There could be some, if you just need also on the ground kind of help doing that kind of work, might be something
we
that we
do
could contribute to.
Yes, absolutely. We already have a job for you. So yes, let's connect. Thank you. Anyone else? Kimberly?
We have a couple
Hi
of.
there.
Oh, sorry.
I'm here. I joined the University of Maine as staff in June, but I actually live in East Machias, and it's really exciting to learn about everybody's work, and this work especially. And I would love to help as in my role as ORD staff. And then also I'm just wondering if there's opportunities for local residents to volunteer time and energy.
Yeah, that is a really a great question. We recently at our organization, first time ever, created a development office that is also helping with volunteer coordination, because it's such an asset, and we're quickly learning how important volunteers can be in the spaces, both at the property, but also in the area of recovery. And, and typically those are people within our own community, and, recovery is a process. And once you've made that decision to go through a process, you need somebody by your side. And we're looking at, volunteers in that area of recovery. We're looking at volunteers on the property as well. So what I would say is, yes, there's opportunities, but in terms of that coordination, I'm certainly not the person, but I can connect you to the person for that work.
Fantastic, thank you, and I'll be in touch. And I completely understand how it also takes time and energy to coordinate volunteer resources. So I'm aware of that too. Thank you very much.
Yeah.
There could be a help there, and you can certainly go get it.
Wonderful. Yeah, that's great. Did you?
So I was just going to ask about if there are particular areas or projects that you would recommend for some of the UMaine Machias college students to work with
Yeah.
Pilot projects, initiatives?
Yeah, I mean, what we do and what Ways does both is like, we want to hear where the students have passion. We actually believe in that passion is the impetus for excellence. And so if we're talking with a student that really wants to be working within the communities, that wants to give back in an area, then we want to know where that passion is. And if that passion has not come yet, then that's okay too. And then we can talk about all the areas where students fit in. We do have, for every summer, we have a Wabanaki SHIP program, which is a summer health internship program. So it's very health specific, that you want to go into health careers, but we also talk about alternative medicine careers as well in that. So we're broad, but it's health specific. So we do have some of those programs for sure. And that's a paid internship. It's 8 weeks in the summer. And you do work in the community. You connect to national leaders in Indigenous communities and medicine. So that's another one. Tish, do you want to talk a little bit? You need the microphone though, or come up here.
So with our WAYS program, what's exciting about that, and with the partnership with Wabanaki Public Health and Wellness, is that our internships can dovetail with what they're doing, but they also, and our priority is that they are long-term.
Yeah.
We really would like our Native youth to be involved from the very beginning of the project to the very end, so they understand all of the pieces. And we connect you with a cultural knowledge keeper and a Western science person, so that you can understand both views and work collectively. And it's really, with our students that have participated, it's been very empowering. And that's really what we want to see, is that growth within the students. I love to hear our students who are now in college challenging the faculty to say, why are you not including Indigenous knowledge here?
Yeah.
When you have that ability and that confidence, that is so exciting. And so we work with our youth. We started as a high school program, but now we are actually going K through 16. So I would love to talk with anyone here, because we do have funds to support you for multiple years on whatever you are jazzed about, whatever that might be, because science is a wicked broad field, as
It
we
is.
know. So.
Yeah, it's actually really exciting. I mean, our Indigenous college students have so many opportunities. You know, a conversation with Tish, a conversation with me. We are both invested in our young Indigenous people. And whatever we can do to connect to the right internship or opportunity, we're here. Anything else? Lois Ann, I think, has a question.
Yes. Well,
Lois.
this has been just remarkable. It's just, I can't believe this is such an amazing entity in our state. Thank you so much, Lisa.
Lois Ann, I don't know if I said, we're hiring 35 more people. So I just want to say that one more time. Go ahead. Sorry.
Oh, I think that's fabulous. Please shout it. I do know we have so many students in our psychology and community studies program that are interested in working with people with substance use issues. And I feel like their education would be so much more expanded with understanding some of the approaches you all have. We're not hiring, but I would love to have you come to a class, or somebody come to a class and talk. And make some connections. We did put in we put in a big grant. I don't know if we'll get it, but it's to have some of our internships paid. All of our students are required to do internships, and it would be amazing if we could somehow jointly do some things together.
Absolutely. Yes, let's continue that. A couple of questions around data real quick. Challenges involve rethinking health research and data governance. Well, I mean, the challenge is huge because the data sets that we rely on federally, state, locally are woefully inadequate. They weren't built for Indigenous people. They were built to keep them out. And if they did that to Indigenous people, who else are they keeping out? Well, really all people of color. And how we collect data is really interesting. Have you ever had a random phone call and they started asking you questions about personal health information? That's how we collect data. Who answers those? Not the people who have been targets of the very system asking the question. We're just never going to be reflected in those systems. So I say, why worry about those systems? Create our own. Create our own. Because the systems that we create, we know are inclusive systems and we believe are the systems of the future because they don't leave anybody out. They make sure everybody's voices are heard. So yeah, there are challenges because those systems are racist in nature. So we work with others. We create our own. And we also understand, and this will be interesting to hear, the value that those systems may hold, even though they were created to leave people out. And so we do as much as we can a two-eyed seeing approach. What is valuable that we can hold on to while still holding on to our Indigenous lens always, right? And so that gets interesting, but we've been creative, and what we see is that our work and the data that we collect, when we did the largest health assessment east of the Mississippi on our Wabanaki Health Needs Assessment, we had a 95% response rate and higher. That's unheard of in survey science, if any of you are in that field. That's unheard of. 30% is great. So the way we're doing it is not only encouraging people to come and have a conversation, it's also more reflective of the community, which is the whole point, isn't it? Or is it not? Right? Tori, please.
I actually have several questions, but I think probably the most universally interesting is what sorts of frameworks do you see as good paths forward for partnerships? So projects and activities that we might undertake together that would support, tribal well-being and provide opportunities for tribal students and for non-tribal students, and conduct research and add to what we know and understand.
Yeah, I mean, you are on the homeland of the Passamaquoddy people. There's a lot of responsibility in that. And what I would say is, in every corner of this university, in every room, every meeting, you have to be asking, where's the Indigenous voice? Where's that lens? And if it's missing, we got some work to do. Right, so when people ask that, I always have to start with home, right? Because that's where we have to start, is how can we do better in our homes, our places of work, right? So I would say that's a big area to think about. There's lots of other things I could say in that area. That's a whole day. But I would also say, if you see areas of synergy in the work that we discussed today, then we want to hear from you. If you believe that you have value to give, we want to have a conversation. We believe in reciprocity. And if we understand what that is, it means if you come and stay with us, we're going to do our best to make you feel good when you're with us. And we want that same feeling. It's a responsibility, it's a contract, right? So I'll stop there because I could go on with that one.
One in particular, I'm not sure if there's others that should come ahead, but so one of the areas that I focus on is in the past, it's looked at the role of dignity and environmental governance and how we make decisions
Yeah.
and that sort of thing. But it's expanded, as you might imagine, because basically anywhere you look at the way humans interact, dignity is at the root of that. And in fact, we've been kicking around the idea of seeking funding to study that more deeply as an element of research, like how the role of dignity in research. So I'm wondering if you might reflect on how dignity plays a role. I think it's obvious in some ways, but I would love to hear your words around it in the work that you are doing and how it's linked to culture. Does that make sense?
Yeah, I guess I haven't thought much about that word. You know, when I think about what word resonates with me in our work, it's love, you know? And when my 8-year-old son asked me, what's the meaning of life? My answer is to love, right? And in loving, there's a lot of responsibility in that. There's a lot to learn. There's a lot to account for, you know, but it's just, I'm not in that frame. So I don't know how I relate to that. I'd have to think about that.
Yeah.
But one thing I heard in what you said was there's connection to the land. There's, you know, what we say is the healing is in the land. And what's so wonderful is that what we know is where Indigenous people hold the land, the biodiversity is greater. And that benefits all of us. So my answer is more land back initiatives. When Indigenous people hold the land, for one, we're known to share, even when it didn't serve us. And we also know the land is healthier. We take care of the land, it takes care of us. Remember the definition of plants. Take care of each other. And when we don't, we're not in balance. There's consequences for that. And we are certainly living those consequences. I think we're good. Thank you all. Thank you for the kind comments. And you can share Brittany Moon's contact information, and she can get anyone set up for more conversation at another time. Thank you all. Do I exit?
Little X at the top.
I'm just gonna.